This is Mitchel Zoler from Elsevier Global Medical News. I'm speaking with Dr. Scott Waldman, who's chair and director of the Division of Clinical Pharmacology at Thomas Jefferson University in Philadelphia. Dr. Waldman has just reported on data looking at the use of a PCR test for GCC, that's a receptor on the endothelial cells in the gut, and using it as a way to assess the status of patients who've had colorectal cancer, comparing it to conventional pathologic assessment of their lymph nodes. So Dr. Waldman, could you tell us how did the use of the GCC PCR compare to conventional pathology in the patients that you looked at?
Well, we applied GCC and RT-PCR analysis, which is a very powerful way of amplifying the presence of biomolecules, to see if we could find metastatic cells that were present in the lymph nodes of patients, but that were hidden from normal standard techniques like histopathology, viewing these lymph nodes under the microscope. And what we found is that in patients that were histopathology negative, that is, no obvious metastases in their lymph nodes under the microscope, that in fact when you applied a molecular marker like GCC using RT-PCR analysis, you in fact could reveal hidden metastases or occult metastases that were resident in those lymph nodes. The prediction was that the presence of hidden metastases, occult metastases in lymph nodes would have an impact on the prognosis of the patient. In fact, in this study, the patient prognosis did correlate with the presence or absence of occult metastases in lymph nodes. Patients that had no obvious metastases, either by histopathology or molecular techniques, those patients had the lowest incidence of recurrence, while patients that had no obvious metastases by histopathology but were molecularly positive by GCC RT-PCR analysis had an increased risk of developing recurrent disease, and in fact their risk of developing recurrence closely mimicked the risk of a population of patients who had metastases that you could see literally under the microscope, who had histopathology positive lymph nodes. And so we believe that GCC RT-PCR analysis is a way of revealing occult metastases in lymph nodes that are prognostically related to the outcome of patients.
Mm-hmm, mm-hmm. And so what would be the next step in developing this?
And so I think in terms of the evolution of the diagnostic, one of the things that we would like to demonstrate beyond its prognostic use is in fact that we can apply this as a predictive marker to identify the patients who are most sensitive to responding to chemotherapy. And so its use as a predictive marker is the next step in the development of this molecular diagnostic.